Kathleen Szegda, and I am the Director of Community Research and Evaluation at the Public Health Institute of Western Massachusetts. I oversee our research and evaluation work, and for our work, we really have a lens of thinking about how can we use data to drive action.
My name is Mabeline, and I'm an instructor at Boston University. And I would add that, so I think that for the role of the Public Health Institute and what we do with research is that it's to gather as much information and then present it to not only our community leaders, whether it's residents, but also the policymakers, to make sure that the people in Springfield and Western Massachusetts are as healthy as they can be. So I think that the role of the Public Health Institute is to say, there is a problem, why are we seeing, certain health outcomes in this population? And so the Public Health Institute tries to, through the research, try to understand what is contributing to that and how can we stop it through the use of interventions and things like that.
And I'll just add, like in a specific example, is when we had the youth health survey, we're always trying to think about how we put information out there so people will actually use it and it can help them. And so we released this mental health summary two-pager on inequities. And so then I got a call from a school committee member, Barbara Gresham, who said, oh my gosh, we have to do something. And so we shared information with her, and she took it to the school committee and said, oh my gosh, we have to do something. And then simultaneously, our partners who we shared this information with at the Springfield Public Schools, the health and wellness director at the time, and the head of counseling, and the school nurse supervisor, we shared it, and they said, oh, we need to do something. And so all of this came to the superintendent, and he was willing to support with, now he had the data in front of him. He had these people who were advocating, and not that he wouldn't have anyways, I'm sure that he would have, but it just really helped to make it easier to say, yes, we need to invest in doing something. So it's the power of putting the information in the people's hands who have the ability to make policy and systems change. Absolutely. And so